when periods of hyperapnea alternates with periods of apnea, the breathing pattern is tamed. Option A, Kussmaul's respiration. Option B, chain stroke respiration. Option C, bradypnea. Option D, tachypnea. The correct answer is option B, chain stroke respiration. Chain stroke respiration is gradual increase in respiration and followed by gradual decrease in respiration, then a period of apnea. Other breathing patterns. First is eupnea. Eupnea means normal breathing. Next is tachypnea. Tachypnea is the increase the rate more than 24 breaths per minute. Bradypnea. Bradypnea is respiratory rate less than 10 breaths per minute. Next is apnea, absence of breathing. Next is Kussmaul's respiration. Kussmaul's respiration, the respiration that are regular but abnormally deep and increased in rate. Kussmaul respiration, respiration that are regular but abnormally deep and increased in rate. Biot's respiration are abnormal breathing pattern with a cluster or group of rapid respiration of equal depth and regular apnea. Group of rapid respiration of equal depth and regular apnea. A client after liver biopsy should be vigilantly observed for option A, hemorrhage. Option B, dyspnea. Option C, vomiting. Option D, pain. The correct answer is option A, hemorrhage. Post-op management of liver biopsy. Turn the patient on the right side. Place the pillow under the costal margin for 2 hours. Assess vital signs 10 to 15 minutes for 1 hour. Observe puncture site for hemorrhage. Tell the patient to avoid heavy lifting and strenuous activity for 1 week. Send the patient to chest X-ray to rule out pneumothorax. Ultrasound of the liver to rule out hematoma. Inform the doctor if patient have decreased VP, decreased heart rate, respiratory distress, changes in level of consciousness. Inform the doctor if patient have increased pain, increased abdominal girth, weakness or dizziness or bleeding. The rationale for using normal saline to start blood transfusion is option A, normal saline is commonly used as a primary IV solution. Option B, it is compatible with blood. Option C, normal saline prevent hemolysis. Option D, dextrose deactivates blood. The correct answer is option C, normal saline prevent hemolysis. In case of blood transfusion reaction, the first nursing intervention would be option A, notify the physician. Option B, stop transfusion. Option C, slow down the transfusion. Option D, administer antihistamines. The correct answer is option B, stop transfusion. Nursing management of blood transfusion reaction. First action is stop the transfusion. Second action is keep the IV line open with normal saline. Third action is monitor vital signs. Fourth action is notify physician. Fifth action is inform to blood bank. Sixth action is prepare medicine. Prepare emergency drugs such as antihistamine, vasopressors, fluids and steroids as per doctor's order. Seventh step is obtain specimen. Obtain urine specimen and send to lab to determine presence of hemoglobin as a result of RBC hemolysis. Eighth step is the blood container or bag tubing attached label and transfusion record returned to the lab for analysis. The priority nursing assessment in an immediate post anesthesia client is to monitor vital signs. Option B, check gag reflex. Option C, assess pain. Option D, assess airway patency. The correct answer is assess airway patency. Post-operative initial assessment. First is the airway patency. Second is effectiveness of respiration. Then monitor vital signs, wound condition. Wound condition including dressing and drain. Fluid balance. Fluid balance including IV fluids, output from catheter and drains, and patient's ability to void. Then level of consciousness. Assess the patient's level of consciousness and assess the pain level. Alkylating chemotherapeutic agent used in cancer treatment act by option A, damaging DNA in the cell nucleus. Option B, destroying messenger RNA. Option C, creating a hormonal imbalance. Option D, interrupting cellular metabolism. The correct answer is option A, damaging DNA in the cell nucleus. The alkylating agent acts directly on DNA, causing cross-linking of DNA strands, abnormal base pairing, thus preventing the cell from dividing. One of the most important signs that the nurse would observe in hypovolemic shock is option A, hypertension. Option B, tachypnea. Option C, oliguria. Option D, cyanosis. The correct answer is option C, oliguria. Signs of hypovolemic shock. Intensive thirst, tachycardia, tachypnea, hypotension, collapsed peripheral veins, oliguria, delayed capillary refill, profuse sweating, cold extremities, anxiety and confusion. Normal serum potassium is option A 2.3 to 3.5 milliequivalent per liter, option B 3.5 to 5.3 milliequivalent per liter, option C 5.32 to 7.5 milliequivalent per liter, option D 7.5 to 8.9 milliequivalent per liter. The answer is option B 3.5 to 5.3 milliequivalent per liter. The normal potassium is 3.5 to 5.1 milliequivalent per liter. Normal serum creatinine is option A 0.5 to 1.5 milligram per deciliter, option B 1.5 to 3 milligram per deciliter, option C 3 to 5 milligram per deciliter, option D 5 to 8 milligram per deciliter. The correct answer is option A 0.5 to 1.5 milligram per deciliter. The normal value of serum creatinine is 0.6 to 1.3 milligram per deciliter. Normal glomerular filtration rate in male is option A 95 ml per minute, option B 110 ml per minute, option C 125 ml per minute, option D 150 ml per minute. The correct answer is option C 125 ml per minute. Normal serum albumin is option A 1.5 to 3 milligram, option B 3.5 to 5 milligram per 100 ml, option C 5 to 7.5 milligram per 100 ml, option D 7 to 10 milligram per 100 ml. The correct answer is option B 3.5 to 5 milligram per 100 ml. The normal serum albumin is 3.4 to 5 gram per deciliter. Increased albumin in condition like diarrhea and metastatic carcinoma. Decreased in conditions such as acute infection, ascites and alcoholism.